Assalamu alaikum and welcome to IQRA TV and to Medicower. I'm your host for this session. I'm Rabina Mia, and today we're looking at the How Your Body Works program again. This is very much around the biology and the anatomy of the heart and how we can look after it. The three questions my guests will always answer are to do with how does it work, what does it do, and how do we look after it. My guest today is our expert in anatomy who teaches anatomy at the University of Leeds, Dr. James Pickering. Hello and welcome, James.
Hi, Rabina. Thank you for
Last
inviting me
time
back.
we talked, thank you, very nice to see you here again, and thank you for taking the time to be with us. Last time we talked about the heart and blood, and this time we're going to talk about the lungs. Smoking and shisha are coming up as well, but you're the expert for me on the lungs. And you said last time we spoke that they do connect to the heart and the heart and blood. So what is it about the lungs that we need to know? What are the lungs?
Yeah, so previously we spoke about the heart and the blood at some length in a previous programme, and they really are intimately associated with your lungs, or what's known as the respiratory system, which is effectively how we breathe, how we bring oxygen into our bodies, and how we get rid of carbon dioxide. Because oxygen, as mentioned in the last programme, is really important to help create energy for our body to work properly. So we have two lungs, and they sit within our thoracic cavity. Now, we mentioned that last time, that's our chest.
Yeah.
So we've got our two lungs sitting above our diaphragm, and they're sitting either side of our heart.
And the diaphragm again is the...
Yeah, so the diaphragm is this muscle that separates your chest from your abdomen, your tummy.
Right.
And that's an important muscle, which we'll come back to later, because it helps us to breathe. So these lungs, two of them, they sit on our diaphragm, and we've got the heart right in the middle. So the heart was in the centre of the chest, and our two lungs are either side.
Why do we have two lungs?
Well, that's I suppose that's a good question. Why not have three or four, or only have one?
I mean, do they do different things, or do they do the same thing? I guess that's what I'm trying to ask you.
No, they do exactly the same
Okay.
thing. And essentially it's the space that's within our chest is occupied by our lungs if the heart isn't there. And that means that we're really maximising our capacity to bring in as much air as we can, so as much oxygen can diffuse, can move across into those red blood cells that are running within the blood that we spoke about last time.
Could you function on one lung?
You could function with one lung, yes, and many people just have one lung and they are perfectly okay. But ideally, we have two lungs, and that brings in sufficient amounts of oxygen into our cardiovascular system, so we can function properly.
So how do the lungs work then?
Yes, so how do the lungs work? Well, for the lungs to work, we need to bring in air. So we need to breathe. And again, we breathe automatically. If you just sit here,
We're doing it.
we're just doing it. Yeah, we don't have to remind ourselves to do it. So just like we didn't have to remind our heart to keep beating to keep us alive.
That, yes.
So our respiratory system, our lungs, just constantly fill with air, and that air is then taken out as well at the same time. So really an incredible part of the human body that it just manages to do this all by itself. So how do we get air into our bodies? Well, essentially it's just to do with pressure. So obviously if there's areas of high pressure and low pressure, then air is going to move from high pressure to low pressure. And what our lungs do is our lungs help to create that difference, create a pressure gradient, so that the pressure within our thoracic cavity is lower.
And the thoracic cavity is the chest area.
The chest where the lungs are.
Yeah.
Is lower than the atmospheric pressure, which is what's surrounding us right now. So because of that difference in pressure, air just automatically passes into our lungs. So how does it just pass into our lungs? Obviously we breathe in through our nose or through our mouth sometimes if we've been doing some exercise. And it passes through a whole series of really, really important structures. But ultimately, it finds its way to the trachea. And the trachea, which you may have heard as the windpipe, sits directly in the front of the throat. So if you were to just put your fingers on the midline, so right in the centre of your throat, you're actually touching part of your trachea there. And specifically, you can feel that kind of hard structure that just sticks out. And that's part of your larynx.
Right. Yeah,
and your larynx or your voice box actually helps us to speak. But air, as you breathe in, passes through your nose, your nasal cavity, and down through your larynx into your trachea. And once it passes into your trachea, it's then within your chest. It's in your thoracic cavity. And it has to go to either your left lung or your right lung. And
how does it choose?
Well, how does it choose? It doesn't necessarily choose. It just passes towards the left or the right, again, depending on that pressure gradient. An interesting fact, actually, if
we're having fun facts,
you like
James.
fun facts,
I like your
Ravina?
fun facts.
Yes. So an interesting fun fact is if you were to swallow something like a garden pea at dinner or a grain of rice or something, then it's actually more likely to fall into your right lung. Yeah. Because as the trachea descends, as it moves down...
I mean if you were choking?
If you were choking, yes.
Okay.
So as it was passing down, the trachea actually divides, it splits into two, like a fork in the road.
Yeah.
It splits into two, and the right, what's called your main bronchus, so that's the tube that the trachea splits into. We have a left bronchus and a right bronchus.
Are these those things that look like broccoli stalks?
Yes, they are, yes. And they lead ultimately to the lungs. And the right one is straighter. So it's like a direct, straight continuation of your trachea. Whereas the left one actually takes more of a sharp turn to the left.
Okay.
So if you were to unfortunately swallow something, it's more likely to end up in your right lung than your left. So that's an interesting fact. It is unpleasant, and we can come to choking later on if you try and eat and breathe at the same time.
Yeah, I'd like to talk to you about that later, yes.
So we've got two lungs, and these lungs are actually incredibly delicate, and they're really soft to touch, and they're really actually obviously important organs. They're really delicate because they're made up of very thin membranes.
I've seen them in the butchers.
Okay.
Yeah, so they do look very delicate actually, and very spongy.
Very spongy.
Yeah.
And actually, if you were to get a sponge...
Not
if you
human lungs, of course, we're talking about animal.
Well, of course, yes. But if you were to, I don't know, clean the car at the weekend and you were to get a sponge and actually just cut that sponge in half, you'd see that it's full of lots of tiny little holes. And that's what your lungs would look like if you were to cut through a slice of lung. Okay. And what you have is lots of what are known as alveolar air sacs. And these are just delicate little pockets formed by these membranes. So the air passes down the trachea, it'll pass into smaller tubes, and we call these bronchi, and they pass into these, eventually, these tiny little sacs. And the reason we have such thin membranes is because on one side we have the air, and on the other side we have our blood. And the fact we have these really thin membranes means that oxygen from the air can pass through these membranes into the blood. And then remember we spoke about hemoglobin, that molecule within the red blood cells
that carries the oxygen.
That holds on to, it grabs the oxygen molecules.
Like a magnet.
Like a magnet, yes. And at the same time, the blood releases carbon dioxide. So you have a process which is known as gaseous exchange. So oxygen moves out of the air, in the air sacs, into the blood, and carbon dioxide moves out of the blood into the alveolar air sacs, and then you breathe out. And as you breathe out, you're getting rid of that carbon dioxide.
So they're swapping.
So they're swapping over. You then breathe in again, and you're bringing oxygen in, gaseous exchange occurs, and then carbon dioxide is expelled. Because one question that a lot of my students ask at university is, why is your blood vessels, why are some of them red and some of them appear blue?
Yes.
And especially
so through your skin, they look bluish, don't they?
Yes. If I take my watch off, you can appreciate that on the surface of the skin you can see these kind of blue lines, these blue streaks, and they're actually your veins. Right. And they look a lot darker in colour than arteries would look like, which are a lot redder. Okay. And that is simply due to the fact that oxygen is bound to the red blood cells in arteries. Right. And once the oxygen has gone to the various organs, that oxygen is used. So the oxygen is no longer bound to the red blood cells. And it's the way light is absorbed by the actual red blood cells that gives it its different colour. So all of the colours you see are essentially due to the way that item of clothing or whatever absorbs light.
Yes, yeah.
So the red and the blue blood vessels difference in colour is all due to the fact that the arteries have oxygen and the veins
Not because I thought I was
don't.
going to bleed blue blood and be royal in any context.
Unfortunately
Totally
not.
disappointing.
No. Sorry, Rabina. Sorry.
No, that's really interesting. And it's such a fascinating question because it's one of those things you often think about and then you never really get the answer to that. I really appreciate you sharing that with us.
No
I shall
worries at all.
remember that.
Yes, thank you. No worries.
What else do we need to know about the lungs? They help us breathe.
Yeah, so the lungs are important, and during the last programme when we spoke about the heart, I talked about the intimate relationship between the cardiovascular system and the respiratory system. And that's because that right side of the heart that sent blood towards the lungs, well, they pass towards the lung taking the deoxygenated blood. That's blood that is full of carbon dioxide. And there the blood has gaseous exchange and it's returned to now the left side of the heart. So the blood that's coming back from the lungs to the left side of the heart is then sent to the entire body. The lungs are really important because each individual lung is divided into what are called lobes. So it's not just one uniform structure. It's not like, you know, the table is just a table. There's actual divisions within the lung, and we call those divisions lobes.
Okay.
So your right lung has 3 lobes and your left lung has 2. The left lung only has 2 because a part of the space where a 3rd lobe would be is occupied by your heart. So there isn't enough room for a 3rd lobe. And these lobes are really important because they function independently.
Oh.
So although we have our 2 lungs and they work for gaseous exchange, enabling us to breathe and to increase oxygen consumption, the lobes work independently, and that's important if you're a doctor or if you're a surgeon, because it means that you can actually remove a lobe of the lung, and the other part of the lung would work perfectly fine.
That explains why it's one of those things I often heard, that you can have some of your lung removed, just like with your liver, I think, and it can still function. And yeah, so now that explains it.
Yeah, so the lungs and the liver are very similar in that way, unlike your heart.
Yes.
So if you were to have part of your heart removed, it just wouldn't function.
No.
But if you were to have part of your lung removed, a lobe, then the rest of the lung would work perfectly fine. And that's the same with the liver. And sometimes you'll hear people, maybe they have a tumour associated with a certain lobe of their lung. And a way to treat that tumour would be just to remove it. And what they'd do is they'd take the entire lobe out.
Okay.
And that way the cancer wouldn't be able to spread to other parts. But the remaining lungs would work perfectly fine. So I suppose that's another interesting fact, although it's not necessarily a fun fact this time.
No, not necessarily. What about the link to breathing, talking, and, you know, like our air passageways, when we have a cold and a cough? What's going on then?
Yeah, that's a really interesting question, actually, because there's actually a long way for our air to travel. We breathe in through our nose, obviously, and then it has to go all the way down into our chest, where our lungs are. And the first place it goes, once it's moved into our nasal cavity, are regions called sinuses. And these sinuses, you may have, I don't know if you've come across sinuses, blocked sinuses, yeah, well, someone says, all my sinuses are blocked, and they rub their forehead and around their nose. Essentially, sinuses are just hollowings. They're cavities within our skull.
Okay.
So we have one in our forehead, we have a few round our nose. And what they do is they're, like I say, hollowings within the skull, and air moves into our nose, into our nasal cavity, and then it passes into these sinuses. And that's really to do a couple of things. If you think on a winter's morning, it's actually really quite cold, and the air you're breathing in is cold. Your lungs are really delicate, and they've got a nice warm, moist environment. They don't want that cold air to rush in against this nice warm environment of your lungs. So what your sinuses do is they help to condition the air, which is they prepare it before your lungs receive it. So what they do is they warm it, and especially if it's quite dry air, they also humidify it. So they change the air into this warm, moist air, which is more suitable for the lungs. So the sinuses are really important.
It sounds like that happens very quickly though.
Oh, it does, yes. So
Yeah.
in one big intake of air, it'll move in, it'll circulate through the sinuses, and then they'll come out and it will pass down into your trachea. But a problem with that is, especially during the winter time, when there's lots of colds going around, is you actually breathe in the bacteria, the microbes that actually cause you to have a cold. And because the sinuses are this warm, moist environment, that's the perfect condition for them to grow.
Yeah.
So what does the body do to try and get rid of those growing bacteria? Creates mucus, snot, and that's what is produced within our sinuses to try and flush out the bacteria that we don't want anymore. And that's why you have a runny nose.
Okay.
You feel it when you go to bed.
Yes.
Because when you go to bed, you toss and turn in bed all night, and it's really the mucus within your sinuses moving around that shifts quite a lot when you're trying to get to sleep.
So how does that then link to coughs and your chest and do coughs always affect the lungs or not necessarily?
Well, a cough is really where you've got there's an irritation, an irritation within your respiratory tract. And your respiratory tract is all of that airway from your nasal cavity all the way down to your lungs. And because you're breathing in various things, you can breathe in irritants, especially if you smoke, for example, then the irritants of tobacco can actually irritate the delicate lining of the respiratory system. And our medical students who will come on after the break will talk about that in more detail. But if you have this build-up of mucus, of snot within your respiratory system, that is really there to try and flush out all of these irritants. A way to forcefully remove that is to cough. So what you do is, instead of breathing out normally, what you do is you breathe out initially a small amount, but you do it against what's called a closed epiglottis. Now, epiglottis is a little flap that guards your trachea. And what that does is that enables pressure to be built up within your lungs. And then once that opens, you effectively forcefully exhale. And that forcing of the exhalation, forcefully exhaling, is the cough. And the increased pressure of that cough is intended to bring up all of the irritants.
It's making me think of an ejector seat and how that
That's exactly right, yes, that's exactly right. But your epiglottis is, as I mentioned, is really important for guarding the trachea, because you don't really want to start talking and eating at the same time, and your epiglottis is important in directing air into the trachea and food down into the esophagus.
And actually that's brought up the conversation I wanted to ask you about choking. What else do we need to understand about choking? And you said talking and eating at the same time is not a good idea. Well, if you've taught the manners that I was taught when I was growing up, you don't do that. But actually, more and more of us are chatting over lunch and things and eating at the same time. So we increase the risk then of choking?
Yes, of course we do. And I suppose the first place to start would be actually, what is talking? Because actually, if you put your hand in front of your mouth when you talk, you actually feel the air coming out. So you're actually exhaling. And I don't know if you can try this with Bina right now.
What do you want me to do?
Well, you can, but try talking whilst you breathe in. So breathe in, a nice deep breath breathing in.
I can't do it.
And try and talk at the same time.
No.
You can't do it. You can't do it. Because talking is actually a really
I never thought of that.
Well, it's a high level, a high order activity that humans can do really well. And although lower species of animals can communicate, they can't articulate as well as we can as humans. And that's all because the air within your lungs, as it comes out, passes through your larynx, which is your voice box.
Yeah.
And you've probably heard of your vocal cords. Now, your vocal cords are just pieces of tissue that sit in your larynx that are like a string on a guitar.
Right.
And if you pluck the string on a guitar, it makes a certain sound.
Yeah.
And if you move your finger closer or further away from the bridge, it makes either a higher pitch or a lower pitch sound. And what these vocal cords do is they guard the larynx. So air is moving up and it passes through these vocal cords. And your vocal cords can just move like this. And that alters how the air passes through them. They can also extend in length. And if you put your hand again on your neck, you feel your larynx. And in a man, that's a lot more prominent.
That's your Adam apple?
That's your Adam's apple, yeah. In the man, it's a lot more prominent. And in a female, in a woman, it's not as long.
Is that why men often have a deeper voice?
That's exactly why men have a deeper voice, yes. So if you go back to the guitar, if you have your hand quite a long way from the bridge, then you have a deeper sound. So a long vocal cord, as the air passes out, will have this deeper voice. You bring it closer to the bridge, you have a shorter vocal cord, you'll have a higher pitch sound. So it's really important that as the air passes through your larynx, through your voice box, that's actually how you articulate the words which you can hear. There's a lot to do with the tongue and the position of your lips and various things as well, but that's part of it. So your voice box is important. So what you shouldn't do is try and talk and eat at the same time. Which
all mothers tend to teach their children.
Yes, I'm trying to teach my children at the moment. I have a 2-year-old and a 4-year-old, and you know, it's don't eat with your mouth full. Don't eat with your mouth full, don't talk with your mouth full. So air comes in and it's using a common tube, and that's the same tube that food passes in. And when it gets to your larynx, the air or the food has a decision to make, or at least your larynx decides what happens. You want your food to go into your esophagus, and you want the air to pass into your trachea. Now, what did I just say about talking? Talking is when the air is coming out, and to do that the epiglottis has to open. Now if the epiglottis is open, that means the trachea is open. So if the trachea is open, then food can, instead of going in the esophagus, can pass down in the trachea. And it's when that food passes into the trachea that is choking, because you don't want that to happen.
So because we're coming to the end of the show, I want this side of the programme, I just want to make sure that we can just understand a little bit about how we'd help somebody that was choking. Where are we all hear about the Heimlich manoeuvre? Yeah,
you have the Heimlich manoeuvre, yes. So, well, I'm not, to be honest with you, I'm not entirely sure the mechanism of it, but essentially it's, to avoid choking, you want to ask them to cough, or you can pat them on the back, and that'll help to dislodge that food and bring it back up into the what's called the pharynx, and then they can either spit it out. But with the Heimlich manoeuvre, what you're doing is you're putting your hands underneath their rib cage, and you're kind of squeezing them, which is forcing the air out of the lungs, and that will forcefully remove this foreign body from the airway into the throat, and then you can also discard it.
So is your top tip going to be don't talk and eat at the same time?
Yes, my top tip would probably be not to try the Heimlich manoeuvre unless you've been trained how to do it. That's an important point. You shouldn't just do that. If you see someone choking, you should ask for some medical assistance. But yeah, the safest way is to not to talk and eat at the same time, and it's rude, of course.
Listen to your mother.
Yes, listen to your mum and see what she says, yes.
That is so helpful. Thank you so much. I can't believe how quickly our time goes when we're discussing these things.
It's a pleasure.
Any other top tips that you want to give before we leave?
Oh, I'm not sure. I think the best condition for the lungs, nice fresh air. So although, you know, we're based in Bradford here having this conversation, it's not that near the coast, but whenever I have an opportunity, I like to visit the coast. Nice fresh air, it clears the lungs, makes you feel a lot better. So that'd be my top tip. Yeah,
and of course there are always those lifestyle things that we're going to talk about after the break.
Of course, and
in relation to what we do to damage our lungs that we need to understand. So that's been so helpful. Thank you. Thank you again for joining us and for helping us to understand about how our lungs not only work, but what do they do. Thank you so much. Okay, everybody, inshallah, after the break, we're going to invite our 2 students back to come and explain how to look after our lungs. And for this part of the programme, we're going to say goodbye to Dr. James Pickering. And inshallah, I'm going to see you after the break. Assalamu alaikum wa rahmatullah.